Psychiatric nursing, one of the QSAN goals that I will be discussing will be teamwork and collaboration. Teamwork and collaboration is one of the things that is very important in nursing care for our residents and for our patients. Nurses have the ability to describe their own strengths and to function effectively within the healthcare team, as well as foster an open communication, such as mutual respect for their colleagues and for their patients, and shared decision-making to achieve quality patient care. Quality patient care is essential, and one of the goals of the psychiatric nurse would be to serve as an essential function for society. They determine diagnosis for people, where they actually assist the doctor in determining diagnoses for persons with mental disorders. They provide care for sick patients and treatment modalities to help manage psychiatric symptoms and to improve their disorders. Although there's a different set of goals for each patient, and those should be designed for each patient. And there are certain broad objectives that should be achieved by the psychiatric nurse when caring for all patients with mental disorders. The nurse must assess the patient and accurately describe the symptoms regarding what type of mental disorder he is suffering from, as well as observing, interviewing, and administering tests to the patient to gain a complete and thorough understanding of the symptoms and his personality, as well as his behavior, his attitude, and his character. Based on the results, the psychiatric nurse must establish a diagnosis or a baseline diagnosis, and then determine the appropriate method of treatment the mental health patient has for that particular individual. The nurse must always provide protection for the patient. She must also be aware that mental health patients do sometimes have aggressive behaviors, violent outbursts, and suicidal attempts. So there are certain goals that must be achieved, and within the QSAN model, the nurse must acknowledge her own potential to contribute to effective team building, as well as function within the team, and appreciate the importance of all intra and interprofessional collaborations. Now, one of the things that the nurse would want to do during this process is to describe her scopes of practice and her roles, and stay within those roles, and describe strategies for identifying and managing overlap in team member roles and accountabilities. If she's not qualified to perform a specific operation or to perform a certain task, she should let her supervisor know. Now, some of the goals that we were working on is during the process, pre-licensure KSAs for QSAN would be describing her own strengths, limitations, and values in functioning as a member of the healthcare team, demonstrating awareness of her own strengths and limitations as a team member, and develops self-development skills, and act with integrity at all times, consistently with respect for different views, acknowledge her own potential, and contribute to the team effectively, and function as a professional member of the team with professional collaboration. And now, one of the goals that as an instructor would have for the student to understand is to identify the presence of teaching strategies within the psychiatric setting, to investigate the student nurse's perspective about her role, because she will be doing role playing and simulation in a psychiatric setting, explore the relationships between the student's academic level and their perspective about the role of the psychiatric nurse. And the instructor will examine the relationship between the student and the client, and how this will play a role in her teaching strategies, as well as in the psychiatric nursing setting. The nurse, the actual student, must establish guidelines for role play, and these are to be expected from the student nurse. to demonstrate the signs and symptoms associated with the client's disorder, as well as appropriately and comprehensively. Demonstrate accurate and relevant history taking. Demonstrate comprehensive assessment skills. Provide relevant nursing care to a simulated case. And provide the information during groups and during anecdotal notes, describing the pharmacological and other treatment options relevant to the simulated case. And this is the end of my presentation.